Hello, I'm Lisa Dye, president of the Infinity Group. Today, we're talking about something that I think a lot of medical practices are either underutilizing or approaching the wrong way: social media. Social media is not just a marketing channel. Done well, it's a way to stay connected with your existing patients, attract new ones, demonstrate your expertise, and show the world what makes your practice special. And it's becoming increasingly important for your search engine visibility too. Whether you're just getting started or looking to improve what you're already doing, this video is going to give you a clear, practical framework. Let's get into it. Let's start with why this matters. According to Bird Eye's healthcare reputation research, reviews are a primary driver of patient choice. 87% of patients read reviews before selecting a provider, and 72% prefer those with a 4-star rating or higher. Your patients are already online. The question is whether you're showing up for them when they are. Here's the most important mindset shift I want you to make about social media. Stop thinking of it as just a sales channel. When patients visit your social media page, they want to see that you're an expert in your field, that you can be trusted, and that you genuinely care about your patients' well-being. They want to see your practice's personality. They want to feel like they're part of a family, not a sales transaction. So when you sit down to plan a post, ask yourself, does this provide value to the person reading it? Does it inform, educate, or entertain? If the answer is yes, you're on the right track. I want you to think about every single post you create through one of 3 lenses: information, education, or entertainment. To inform means sharing timely, relevant information. Practice updates, seasonal health reminders, new services, community events. Keep your patients in the loop. To educate means demonstrating your expertise. Explain a common condition. Break down a procedure. Share preventive care tips. When patients see that you know your stuff and you're sharing it freely, trust builds naturally. And to entertain means showing your personality. Behind-the-scenes moments, team birthday celebrations, a funny but appropriate moment from the office. These posts often get the most engagement because they feel real. People connect with people, not logos. If every piece of content falls into at least one of these 3 buckets, you will never run out of things to post. Now let's talk about where you should be posting. Not all social platforms are created equal for healthcare practices, and trying to be everywhere at once is a recipe for burnout and mediocre content. Let's walk through the main platforms and help you understand who's actually on each one. I want to start with Facebook because it has over 3 billion monthly active users. It is still, by far, the largest social platform in the world. And look at these numbers from the Pew Research Center. 75% of U.S. adults ages 30 to 49 use Facebook. 73% of adults ages 50 to 64, and 65% of adults 65 and older. These are the patients who make appointments and need chronic conditions managed. Don't sleep on Facebook. I want to spend a moment on what I call the Silver Surfer opportunity because I think it will genuinely surprise some of you. Adults 55 and older are among some of the most active Facebook users. According to AARP, adults age 50 and older control 70% of all disposable income in the United States. They spend $7.1 trillion annually. If you're looking to attract patients in this age range, you need to be active on Facebook. Instagram has 2 billion monthly users and is excellent for visual storytelling. TikTok has exploded to 1.5 billion users, but requires a consistent supply of short-form video content, which can be a challenge for most practices. We recommend starting with Meta, Facebook, and Instagram first. I need to spend a moment on HIPAA because it is non-negotiable and applies to everything you do on social media. The same privacy rules that govern every other patient interaction in your practice apply fully to social media. That means never post anything that could identify a patient. Never post photos of patients without a signed written release form. Never respond to a comment in a way that confirms someone is a patient. When in doubt, keep it general. Social media is no longer separate from your search engine optimization strategy. Google now indexes social media profiles and posts. An active, well-maintained social presence signals credibility and feeds Google's EEAT framework. Before I close out, I want to briefly mention how the Infinity Group can support your social media efforts. We offer full-service management, targeted advertising, and consulting. Visit us at infinitymedicalmarketing.com if you'd like to learn more. Thank you so much for watching, and I look forward to connecting with you.